of the tutorial, which is free and available to anyone who is serious about elimination of hepatitis B. This is the last of the series of these tutorials with an intention to give you all the basic knowledge and advice you need so that you can keep safe and or talk to those who need to keep safe from contracting hepatitis B. Vaccination is key. Vaccination is not an alien terminology to many of us, as it has been the key to preventing many viral illnesses. Luckily, hepatitis B virus has a vaccine that works against it effectively. You just need about 3 or 4 doses and very rarely a booster at some point, maybe 10 years afterwards. It is more than 90% effective to prevent new infections, thereby prevent even the complications such as cancer. It is important that if you live in an endemic region or you are at risk in terms of your job, then you actually access the vaccination at your local place for help. This will help significantly. The second part of prevention is prevention of mother-to-child transmission. And this is very key because a lot of people who have hepatitis B have contracted it from their mothers. Mothers who have had the virus will pass it in utero, that is while the children were in the womb and or during birth. The prevention of mother-to-child transmission is effectively provided with the help of the obstetricians. What happens here is that the baby is given a birth dose vaccination against hepatitis B alongside with other vaccinations given to children to prevent illnesses at birth and subsequently to complete the rest of doses. If the mother's status is definitely viremic, then there is also an immunoglobulin that is given about the time of birth as well in a different arm to the baby. This is to prevent any possible seepage, let me use that terminology, of the virus into the baby at the time of birth. That is to provide a double prevention. However, we know that in many developing countries, this is quite expensive and not available, in which case there has been evidence that the birth dose vaccination against hepatitis B is actually quite effective. Safe practices is not a very uncommon terminology here with the advent of HIV. What that means is barrier, because we know that hepatitis B is transmitted via sexual fluids. And so barrier sexual practices, in other words, if you are at risk of multiple sexual involvement or if your partner is infected and they're highly viremic, in other words, they're having active multiplication of the viruses in their blood, to prevent you getting the infection, then there has got to be a use of a barrier method such as condom. The other thing is about illegal drug use. For example, intravenous drug injections. This is a very direct route that can predispose people from getting the hepatitis B. Avoiding that will be key in helping to prevent adults, in particularly in developed countries. Although we do know that there are cases of intravenous drug abusers in the developing countries as well. Right, healthcare workers are at special risk because they take care of patients who are infected and they themselves might be infected and so on. So their risk is quite heightened. It is recommended that if you are working in a hospital to get tested so that if you are negative and are not immune to hepatitis B, to get some vaccination before you practice, particularly if your practice is located in endemic regions of the world. Right. For those who cannot, for example, avoid intravenous drug uses, it is recommended that they enroll into needle exchange programs, which ensures that the sterile needles are actually available for them. These pictures are by no way representative of the fact that this child is an intravenous drug user. It is basically for display purposes. I think it would be important that if a partner or somebody has hepatitis B, that they get to see a doctor. Because some of the advice I'm providing here will mean that if you have somebody infected and you're living with them, if they are on treatment, then your chance of transmitting the virus is low, because when treatment is given, the viral load will be low. And when that is the case, then you are very, very, very safe from transmitting it to your partner. I think this is very key in the prevention to hepatitis B. There are others, but I do not want to confuse you with this robust lecture that you may have enjoyed. You can go over this again so that you are quite well informed about this. There are other means that I have not discussed here, but please do find any or send me comments so that I can advise further if you need more help. Thank you very much.